Hi, my name is Shanbhag. I'm a consultant orthopedic surgeon. Today I'll talk to you about Dupuytren's disease. Dupuytren's disease is a disease of the palmar fascia. Palmar fascia is the tissue which lies between the skin and the underlying important structures in the hand, namely the tendon, the nerves, and the blood vessels and bones. This palmar fascia acts as grout. It's a space filler and it acts as a shock absorber. In some individuals, especially those of Northern European or Caucasian origin, the body sometimes tells this palmar fascia to change into scar tissue. The scar tissue starts off as little nodules. The nodules join together and form cords. The cords grip the skin, pull the skin down, and along with the skin, the fingers at the joints, producing deformities called as contractures. These contractures commonly occur in the ring and the little finger, but they can involve all the fingers in the hand. In the initial stages, when the disease produces nodules, these can be painful but don't interfere with function. In these situations, one can often inject steroids, which will help to deal with the symptoms, but don't really alter the natural progress of the disease. When fingers develop contractures, these can then start to interfere with day-to-day activities, with your job, and with your hobbies. Sometimes the disease can occur in people who are young. This generally tends to happen when you have a strong family predisposition to the disease. When this happens, the recurrence rates as well as the severity of the disease can be quite significant. The disease can then be triggered by minor things like hand injuries or surgeries like carpal tunnel syndrome. If the contracture reaches a point where it starts to interfere with function, then surgery would be the way forward. Surgery is called as a fasciectomy. Dupuytren's fasciectomy is carried out as a day case procedure. You're in and out on the same day as your admission, and the surgery is generally carried out under regional anesthetic, where my experienced hand surgery anesthetic consultants would inject the top of the arm with local anesthetic to numb the arm up. Each surgical procedure will be discussed in detail to discuss the pros and cons. I believed in a shared decision-making process with my patients to make sure that everybody is comfortable with the choices which are made. After surgery, you would have to keep the wound clean and dry for me for about 2 weeks. You're allowed to use the hand, but you cannot get it wet and you cannot put too much pressure on it. After the surgery, you would also be seen by my hand therapy colleagues. These experienced physiotherapists will guide you through the post-operative rehabilitation process. They will teach you tips and tricks to get the swelling down and to minimize scarring to enable you to return to full function and to your job and to your hobbies. So if you think you have a lump in the hand or a contracture which might be Dupuytren's, please don't hesitate to get in touch and I'll be happy to help.